Hello, everybody. My name is Jesse Hicks. I'm the Vice President of Advancement for the Minneapolis Heart Institute Foundation, and I'd like to thank you all for joining us here today. Today it's my privilege to introduce Dr. Courtney Baechler, who will speak about heart health, mental health, and best outcomes during COVID-19. But before I do that, I'd like to say a couple words about the Minneapolis Heart Institute Foundation and our wonderful partners. The Minneapolis Heart Institute Foundation was founded over 38 years ago with a mission to improve cardiovascular health through research and education. We are an independent nonprofit organization with great partners in Allina Health, Abbott Northwestern Hospital, and the physicians of the Minneapolis Heart Institute. Our team is made up of 80 plus staff who have a focus on research and education with our goal to improve cardiovascular health across the globe. As I mentioned before, we're here for research and education. We consistently have over 200 studies underway with over 2,200 participants happening across all areas of cardiovascular health. We also play a role in the development of future leaders in heart health with our internship program. To date, we've had over 192 interns who've gone through many of our programs, and many have selected a career in cardiology. Our physicians are also dedicated to publishing their findings, with over 200 peer-reviewed manuscripts published annually. The impact of cardiovascular research and education is present here every day when it comes to the Minneapolis Heart Institute Foundation. You can see that we're first in world and first in human achievements across research. We find hope and inspiration through our patients in the eyes of those stories. Our commitment to education across the community and across the world continues, and we're looking to change those international protocols to save lives. This is only possible because of donors and the generosity that happens every day. I'd like to thank all of you who have been able to make a difference in the lives of our patients through research. And if you're interested in playing a role yourself, there will be information at the end of this presentation for you to take a look at. MHIF has current updates. If you want to find more about heart health related to COVID or heart health and the research that happens with our physician partners, you can find that on our website. We'll have that information at the end of the presentation. We also look for, to bring a focus of generosity. We brought forward a Grateful Heartgram, where we share stories of inspiration. You get a chance to tell your own and play a role in how you can make a difference in the world through those feelings. Now, I'd like to welcome Dr. Courtney Jordan Baechler, and I do have some information on Dr. Baechler. She serves as Program Director for the Minneapolis Heart Institute Foundation Emerging Science Centers, including Women's, Cardiovascular Research, Prevention, and Global Outreach. She's a general cardiologist at the Minneapolis Heart Institute who's passionate about healthy state of well-being, body, mind, and spirit. As a national leader of integrative medicine and wellness, I'd like to welcome Dr. Baechler.
Thanks so much, Jesse. Good afternoon, everyone. I'm so glad that you've taken some time to take a little pause in your day and to learn a little bit more about your heart health, mental health, and best outcomes during COVID-19. It's exciting that you can do this while there's a little cloud cover, and I think there's going to be a little sunshine this afternoon, and you can have a chance to really enjoy all that we have to offer in Minnesota. So I wanted to start here thinking a little bit philosophically about why we don't always think of the heart and mind and our mental health all being connected as one. Here are just some frequent sayings that we hear. Heart of stone, right? Someone that perhaps is a little bit more harsh, they're a little bit more abrupt. Heart of a lion. We think of people as being courageous, willing to do things that are brave. Heart and soul, think of folks who are energetic, where really they're living out their life's work. Wearing your heart on your sleeve. Sometimes we think about those folks as being very transparent in their feelings. The heart of the city. We think of all these bustling cities that will be back again one day soon, but really where traffic and people and things flow. Winning someone's heart. Again, sort of capturing a person's feelings or aligning that way. Having a big heart, being generous, being kind, etc. And finally, breaking one's heart, perhaps sadness, depression, etc. And speaking from your heart, being very authentic about your thoughts and feelings. So I say all of this to have folks think about the reality that when we think of songs and poetry and art and literature and history and religion, we always talk about the heart and mind being connected, about how our really, again, our broad mental health, mind, body, and spirit collectively is all connected. So perhaps as you hear these statistics, you won't be that surprised. This is one of my favorite quotes from Hippocrates. You ought not to attempt to cure the body without the soul. The cure of many diseases is unknown to physicians because they disregard the whole. Many of you might know that as physicians, we go through the Hippocratic Oath, where it's a step to being a doctor, where we pledge to do no harm. And this is, again, a quote that's hundreds of years old by Hippocrates, but it's as we've evolved in medicine and we've gotten to this place that we often break things down into an organ system, whether it be your heart, your kidneys, your diabetes with endocrine, or whatever the case is, we sometimes forget about the reality that we are all connected as one being. So let's talk a little bit about the data. This is one of my favorite studies that I like to cite. It's the INTERHEART study that was done by the European Society of Cardiology. And it was a standardized case control study where the goal here was to determine the risk factors for cardiovascular disease. And in this trial, they were specifically looking at the risk factors for having a myocardial infarction, which is, fancy for a heart attack. And they wanted to be very broad, looking at all of the risks that were attributed to whether or not someone would have a heart attack, looking at ethnicity, geographic region, and then weighing these things. So you can see that it was a large study with 262 centers across 52 countries in Africa, Asia, Australia, Europe, the Middle East, and North and South America. So much of our global world. And let's see what they found. So the INTERHEART study showed that psychosocial factors, which were defined as depression, stress, anxiety, anger, and social isolation, account for 32% of your overall cardiovascular risk. So that's really as much as tobacco abuse. It's as much as when we measure abdominal obesity. So it's very, very, very significant. We have tons of studies out there looking at this further and really, again, drawing how important the mind is in our heart outcomes. So we've known that psychological disorders and personality characteristics have been shown to have a negative impact on overall cardiac health. We know that depression prevalence rates are up to 3 times higher in cardiac patients. And when you look into that deeper, we don't actually know whether it's that depression causes the heart event or if the heart event leads to depression. We see both. And we know that once someone does become a cardiac patient, they're at increased risk of experiencing overall emotional distress and impaired quality of life compared to the general population. And finally, both depression and anxiety have been linked with atrial fibrillation. So again, this same chicken and egg where we know that people who have baseline depression and anxiety are more likely to get atrial fibrillation. And then we also know that people who have atrial fibrillation are more likely to get depression and anxiety later. So a lot of these things, it's difficult to figure out what happens first. So this is one of my favorite slides because it's often as a working mom how I feel. But if you could actually see the fine black print in here, which I appreciate you can't, but you would understand the physiology that helps us to understand 70 to 90% of all visits to healthcare are related to stress disorders. So if you didn't already know this, there's actually an American Institute of Stress out there, and that's where this slide comes from, and you can take a look and Google that. But it basically, the slide goes to every area of the body. So for instance, like when we think about the gastrointestinal system, sometimes when people are nervous or feeling stressed, maybe before an exam or before a big presentation, whatever the case is, we'll describe butterflies in their stomach, right? But that's not in our mind. That is our brain being connected to our gut and producing stress hormones that make us feel nervous, make us maybe feel bloated or whatever the case is. And these same things happen to our heart, which I'm going to explain to you more going further in the next slides. And what we see from a clinical perspective is sometimes people will have shortness of breath or whatever it is that they're coming in with for years, and then, or months or weeks, whatever the case is, and then something else in their life happens. They lose a job, they have a bad argument with a spouse, whatever the case is, and that then leads to them coming into the emergency room that particular day. So very, very interconnected. As somebody who's helping to lead the Women's Science Center here, I would be amiss not to mention women's mental health statistics. So each year, 1 in 5 women has a mental health challenge. And I just want to emphasize that's not because of biochemistry differences. It's not because women are weak. 99% of our human genomes are the same across the board, gender, race, ethnicity. But we also see depression being 2 times more common in women. Women are twice as likely to experience post-traumatic stress disorder, or PTSD. Women are 2 times as likely to experience generalized anxiety disorder. Women earn less than men. Women who work full-time earn about 20% less than their male counterparts. And finally, when we look nationally, about 65% of caregivers are women. If I had more time, I would also put these same statistics up from an ethnic and racial disparity perspective, because again, unfortunately, we see much of these statistics being the same when we break things down that way as well. So let's talk about what happens with stress. So why is it that our mental health is so important to our cardiac health? So again, I love some of these old statistics because as someone who loves research and innovation and new things, we're always looking to find some new ways to think and behave, but it turns out a lot of this has been known for some years. So this is from the 1600s, William Harvey, who described stress as a mental disturbance provoking pain, excessive joy, hope, or anxiety, extends to the heart where it affects its temper and rate. And sure enough, that is exactly what happens. So when we feel stress, it increases our sympathetic nervous system, which for those of you who know that term, that's our fight or flight response, which then internally tells our body to increase our blood pressure, increase our heart rate, which then leads to increasing our blood sugar, which leads to increase in insulin, and ultimately increase in inflammation, right? And this is here really because historically we needed to, from an evolution perspective, if a tiger was going to be chasing you, right, you need to instinctively have these things happen without thinking about it. So if you put your hand on a hot stove, that your sympathetic nervous system takes over and pulls your hand away without you even having to think about it. But what turns out is back, a few months ago when we had traffic jams, right? We don't have those right now, but when we did have traffic jams, when I'm on 94 and I'm late for a meeting and you're multitasking and doing all the things you are, our bodies feel like that traffic is that tiger. But it turns out a lot of what we're dealing with now is just this constant stress. And some of the things that we talked about, having high levels of a heart rate and blood pressure leads to high blood pressure long term. Having high blood sugar leads to diabetes long term, et cetera. So we can't have this on overdrive. So again, what does this mean for the heart? Well, this is probably the most fascinating syndrome of sorts as it relates to the mind and heart. It's called the broken heart syndrome. I'm sure many of you have heard of this. It has a few different names. Stress-induced cardiomyopathy is one of them. Takotsubo was how it was originally defined by Japanese cardiologists, which defined it. Takotsubo means octopus in Japanese, and it's basically that it looks like an octopus is inside of your heart. And what happens is that it's actually a surge of stress hormones. So as cardiologists, we will see patients come into the emergency room and it looks as if their EKG, their presentation looks as if they're having a heart attack. We often rush them off to the catheterization lab where we perform an angiogram to make sure their arteries aren't blocked. And then sure enough, their arteries look fine. But the muscle of this heart, the so-called Takotsubo or octopus, is not behaving right. And when we have more time, because obviously at that moment we think it's an emergency, we think they're having a heart attack and we need to get that artery open, when we go back and talk to that patient, more common than not, we'll find that they had a very significant life event. Someone died. Something happened very unexpectedly, something very negative, a bankruptcy, whatever the case might be. It's more common in people over age 50, and it's more common in women. And right now there is active research going on at Cedars-Sinai where they're again looking specifically at the brain-heart connection here. So this is truly a medically defined syndrome. So as we're going through all of this pandemic now, we obviously have to think about our mental health. And this was taken from the Washington Post, and just how people are feeling with the coronavirus. And you can see here statistically, most people feel that their life has been disrupted at a minimum of some. 70% of people feel that this has been a source of stress, and 69% of people are very or somewhat worried. And so now more than ever, it's a time for us to be thinking about our mental health because we're under stressors that we've never seen before. So don't worry, I have lots of thoughts on how you might do that. So let's talk about what we've learned over the years at what works, and again, specifically for our heart and minds as a whole human being. So lifestyle medicine is something that you'll hear a lot about. It's defined as a whole foods, plant-based diet, which includes stress management techniques such as yoga and meditation, moderate exercise like walking. And what I want to emphasize about this is that we are so limited, right, these days on what we can do. But it turns out, as much as my CrossFit loving patients want it to be about interval training or high intensity intervals, the studies really are just having people moving and walking. It doesn't have to be this high level of cardiac fitness. And then finally, social support and community is critical, which we're going to talk more about. So this trial, which I'll show you the outcomes from, was specifically talking about the importance of someone feeling loved and having a sense of intimacy, which doesn't always have to be sexual in nature, but just that you really can truly, back to wearing your heart on your sleeve, that you can actually be fully transparent with another human being. And I have on the bottom just some pictures of what a plant-based diet looks like, because oftentimes people say that that's so extreme, but really it's becoming more and more popular, and would just encourage people to take a look at what's out there. There's lots on the internet from that perspective. So Dean Ornish, who's one of my heroes, he's a cardiologist that worked at Harvard for quite some time, and he did the majority of these trials looking at lifestyle as medicine. And as you can see here, can lifestyle actually reverse heart disease? So I want to emphasize that this was a trial. It was done years ago now. It was done in 1990, but it was a prospective, randomized controlled trial. So really, as a researcher, the best trials out there. And it was a 1-year lifestyle modification. You can see what it included. It was a 10% fat, whole foods, vegetarian diet, which again, these days we would not lower the fat that much. We would want it to have the good fats, avocados, nuts, olives. Those are critical for brain health. But then it included aerobic exercise, stress management, smoking cessation, and group psychosocial support. And then what they did is they actually had people go to to our angiogram suites or our catheterization labs to look before and after at what was happening to the blockages in their hearts. And they actually had a reduction in their overall area of narrowing or stenosis. So you can see that the control group, so the group that did not get this intervention, actually got worse. They went from 42% to 46%. And then the lesions over 50%, and so again, the areas that are narrowed by at least 50% had the biggest improvement. And these actually held and improved further 5 years down the road. So I always, as a preventative cardiologist, I always have patients say, is there anything I can do to actually reverse this? And this is a program that in Florida and California is actually reimbursed by Medicare. So we can actually do a lot to, if nothing else, stabilize heart disease going forward. So let's talk again about some of the other things that have shown to be important in mental health and cardiovascular outcomes. Another one is transcendental meditation. So for those of you who are familiar with meditation, this is sort of the most serious type of meditation. It's the one that's most studied just because it's easiest to control. But you can see lots of trials out there showing that doing Transcendental Meditation reduces cardiovascular risk factors, morbidity, and mortality. I mean, again, so we're talking about overall death rates, where if we could bottle this up into a pill and we invested in it, we would all be doing fantastic. So there's actually been further looks, randomized controlled trials, that's what the RCT stands for, to look at insulin resistance. So again, we're talking about diabetes management and seeing improvement there. Autonomic tone, which again is a way to help with blood pressure. And then finally, looking at our carotid intima media thickness, which are those arteries in our neck. So people who did Transcendental Meditation had improvement in all of those. There was a small trial done by Schneider that showed a 30% reduction in cardiovascular death in patients who were randomized to Transcendental Meditation. And then finally, there's been a lot of work specifically in various racial and ethnic groups, one of which being African American patients, where they showed African Americans who participated in Transcendental Meditation had a 48% risk reduction in all-cause mortality, heart attacks, and stroke. So again, I would argue this is something that's free. It's not something that's often talked about, but part of that, again, when we look at why we think that is because of the neurohormones it's producing to help send our body that sense of calm. Guided imagery is another tool that people can use. So this is a trial that was done in 2006 by one of our cardiovascular surgeons here at the Heart Institute. And what we did was we gave folks little guided imagery to listen to before and after surgical interventions. And for those of you who aren't familiar with guided imagery, again, this is something that you could Google. You can have free resources too. There's lots out there. But for me, when I do guided imagery, I take myself to Hawaii. So you consciously think about, or you take yourself to your favorite place. And for me, Hawaii is one of those places. But you think about the way that it smells. Can you smell pineapple? Can you taste salt from the ocean? Can you feel an 80-degree day and sand in your toes? You really try to get all of your senses to actually bring you to that other space that is calming. And it's great if you're ever in a meeting that you don't want to be in or something like that. But what we found is that pain and anxiety were significantly reduced in people who participated in guided imagery prior to their heart surgery, and that by doing that, we decreased length of stay by 2 days. And again, it just shows how important it is as you're going into surgery to be in a mind frame of, I'm going to do great, I am calm. What we don't want people to do is be understandably very concerned about that outcome and already have that fight or flight response going. Biofeedback is another well-proven area to look at how the mind helps control our sympathetic nervous system. So this is, for those of you who aren't familiar with it, it's kind of like an EKG only for the sympathetic nervous system. And so what it does is it, as you can see in this picture here, it hooks up a client or patient to a computer where we can then look at your muscle tension, your skin temperature, your heart rate, and your respiratory rate. And then you are basically taught breathing techniques and muscle relaxation. And then there's been trials that show, again, that it is helpful for lowering stress and lowering blood pressure, and that it increases our heart rate variability, which is part of what we want for a healthy heart. So I often send my patients that are working on these things to biofeedback, and then Heart Math is a item that you can purchase online that's basically a modified biofeedback to do at home. Tai Chi is another one that's been very well studied. So this is an ancient practice, again, getting back to some of the ancient wisdom that we have here, and basically is a moving meditation. So I know if you're like me, sometimes meditation can be hard to be fully still and fully relax my brain, that Tai Chi is an easier way to be moving very slowly and thoughtfully. But this was an NIH, or National Institute of Health, sponsored trial, and it looked specifically with folks who had heart failure and a reduced ejection fraction, that's what EF stands for, of 40%, and they were overall New York Heart Association Class 2 patients, so symptomatic heart failure patients. And they were randomized to 12 weeks of Tai Chi or usual care, and you can see that the folks who participated in Tai Chi had an increased quality of life. We measure in our heart failure patients how far they can walk in 6-minute time, and they were able to walk farther. And finally, a reduction in their serum BNP levels. BNP is something in our blood that we measure to see, basically looking at the heart stretch. And so that's something that we routinely look at in heart failure patients. And the folks who participated in Tai Chi had a lower level of that, which is favorable. This is some more work that we did here right at the Abbott Northwestern in partnership with the Penny George Institute for Health and Healing. And we specifically looked at patients who were inpatient at the hospital, pre and post integrative medicine techniques to help lower pain and anxiety. So this was a 1-hour session, either working with aromatherapy, massage, relaxation techniques, all sorts of stuff. And you can see that we had a statistically significant improvement in both pain and anxiety with just a 1-hour session. And we published that as ways that, again, we can think from a whole body perspective, whole person perspective, mind, body, and spirit. Finally, just a few other tips here before we open it up for question. Sleep is a critical element for all of us. So on average, 100 years ago, we averaged 8 hours a night of sleep. And these days, we average about 6 hours a night. So not surprising, right? Chronic sleep deficit leads to weight gain, more immune compromise, less restoration, and more inflammation. And when we think about the majority of chronic diseases that we are seeing right now, when we think about diabetes, obesity, high blood pressure, high cholesterol, heart disease, etc., all of this is a recipe if we don't get enough sleep. So as I frequently say to my 9-year-old, what are the things that you're in control of right now during this COVID time? How much sleep you get, how many fruits and vegetables you're eating, and that you're getting outside each day, right? Those are good ways to augment our immune system and our brain function. Critical to our brain, to our immune system, is our brain function. This is one quote that I just love, because you can kind of pledge today that you're going to be thinking more strongly going forward about how you can manage your stress. And this quote, again, I just love. Peace, it does not mean to be in a place where there is no noise, trouble, or hard work. It means to be in the midst of those things and still be calm in your heart. And I love that, again, because it involves the heart, but also because of the reality that no one is trying to say that I have a magic pill or something to tell you today to make COVID go away. None of that is possible right now. But what is possible is how we let our body react to this and what we do. Formally learning how to relax, learning to let go of the things that we can't control, and then creating time each day to do something that you enjoy is critical. So one of the key elements to that is your social connection, and we know how important it is for people to be socially connected. We have data on, again, the impact that has on your heart health and the impact that has on health overall. People live longer who socially connect. I meant to incorporate this into my slideshow, but I wasn't sure that I had the people's permission. But there's a group of men who meet outside of the apartment building that I live in every morning between like 7 and 8:30, and they've been doing this essentially all through COVID, being appropriately social distance. They come, they have coffee, sometimes they're not all there, but I think this is just a critical piece of how what makes us human. So I routinely actually write a old-fashioned prescription out to my patients and say, you need to go home, you need to find a time to put on your calendar to make sure that you are connecting as authentically you, which often means not in our other roles as a spouse, as a mom, at whatever that case is, but with whatever friend group that might be for you. So I always let people know when I'm talking about mental health that I'm not up on this pedestal as someone who hasn't interacted with adversity and challenges in life. This is my lovely Sophia, and she passed away almost 5 years ago. So I put these things to test every day as I build my scaffolding on what it takes to stay well, and as I try to keep a family afloat with that. And this is just a picture from my 9-year-old who, experienced the loss of his sister at 5. And again, lots of these techniques have been used But the one on the left is him writing with his grief therapist, "My heart is connected to Sophia's by the invisible string." And that's our favorite book and great one for people who are dealing with grief overall right now. The Invisible String is great for kids. And my daughter's best friend, Finding Sophia in New Ways on the right. So just know that this comes from a place that's dear in my heart of how we really try to take care of ourselves in this time going forward. So with that, I will take some questions.
Alrighty. Well, thank you, Dr. Baechler, for that presentation. That was excellent. We really appreciate you sharing your time and expertise. As Dr. Baechler said, and for those of you that can't see me, I'm the moderator. My name is John Rickard. I'm the Education and Communication Specialist here at the Minneapolis Heart Institute Foundation. And Dr. Baechler, if you could actually advance the slideshow just one more. This is the Zoom Q&A walkthrough. I know a lot of our attendees are getting a lot of practice with Zoom. But for those of you that don't know how to ask a question, this is a brief walkthrough, and the way that you do it is you drag your cursor to the bottom of your Zoom screen, which will pop up a control bar, and click on that Q&A tab to ask a question or submit a comment. And just know that this is the only way that you can ask a question or submit a comment. And with that, it looks like we have a couple questions in the Q&A pod. And the first question is, what is a good source to stay up to date on mental health research and therapies?
That's great. Great question. So it depends, I think, on what you're looking for. So for instance, the European Society of Cardiologists has a really great document that you could Google that they put out a statement in 2019, so very recently, just about depression overall and heart outcomes. And it literally goes through all sorts of different types of heart issues, so atrial fibrillation, heart attacks, sudden cardiac death, all sorts of things, and how these are interconnected and what has been shown to be helpful. So if you want something very scientific, that's out there. There is a growing interest, I think, from researchers overall to be doing more, specifically from a heart perspective, because we know that this is a key area, but we still kind of have it a little bit separate, where you come to your cardiologist for your heart health and then you go to somebody else for mental health. And just recognizing that we need to think more holistically like that. So you can get the real science that way if you want. Otherwise, what I would say is, on the spectrum of mental health, there's still so much stigma that goes with mental health, but pretty much everybody goes through cycles of feeling better and worse, and however we want to define that or diagnose that, people have stress in their life and situations that way. So I think looking at what's out there on the internet is such a personalized approach in terms of figuring out what's going to work best for you based on personal preferences. But what matters is that you're exploring and trying different things to see what works.
Thank you very much. This attendee writes, what are the benefits of supplements? Do you have any recommendations? Thank you.
Great question. I get asked about supplements quite a lot. So first of all, I always emphasize that I really want people to get the majority of their nutrition through food. And so if you are on a limited income, which most people don't have endless resources, then I think it's really important that you look again back to fruits and vegetables, where the majority of the nutrients exist. Above that, as you're looking for specific recommendations from a supplement perspective for mental health, B complex vitamins are one that comes up very quickly in terms of recommendations. Sometimes fish oil, if you're not eating fish routinely, just that's also been associated with improved mental health outcomes. I would also suggest Henry Emmons' work. He is a integrative psychiatrist, and he has a book called The Chemistry of Calm that is actually a workbook that takes you through both supplements and sort of ways to help to calm overall, which is very interconnected to happiness. And there's a full list of potential supplements, but it really varies on what the goal is for you. So, L-theanine is one that I use for anxiety and sleep in folks, but I always want people to try a supplement one at a time, try it for a month. Do you see and feel a response? If not, then don't continue on it just because it worked for your friend.
Excellent. Thank you very much for that. So this attendee writes, and I think they're referring to meditation and therapies like that, but they write, how do you incorporate offering services such as these to your patients in your daily visits? Is this something you discuss with each of your patients?
Yeah, so it's a big part of how I practice. I think many of you might know that prior to this, I served as medical director and vice president for the Penny George Institute for Health and Healing, which is one of the largest integrative health departments within a health system. And again, I think for me, I just have never been able to kind of cut ourselves at the neck. And while some patients have more interest in pursuing a more traditional pharmaceutical and procedure approach, I always feel like my role as a physician is to make sure that you're coming to me for advice on everything that you can do to be healthy and to mitigate a second event or to not have one in the first place. And so for me, that includes all of these types of areas. And a big part of what we talk about is, besides drugs, besides interventions, what else do you need to be doing?
Excellent. Thank you very much. So the next question is, could you speak to how COVID exemplifies the need for proactive heart health or mental health? And what is the foundation doing in the area of prevention?
Yeah, great question. So I think, you've probably heard many of these questions and concerns about second and third waves, not so much just of COVID, but of related other bad outcomes if we don't do things to mitigate that risk. And so one that I think many folks who've been on the Pulse series have heard before is that we are concerned that we're seeing less people present with heart attacks. Those numbers have gone down significantly. So while we're glad that people are staying home, we want to make sure that for people who are actively having symptoms of chest pain or breathing problems or whatever it is that they're concerned about from a heart perspective, that they're getting evaluated, because we are concerned that we're missing heart attacks during this time. Along with that, unfortunately, we see our mental health outcomes right now skyrocketing. So domestic abuse is higher than we've seen, and sometimes on parents, individuals, people are more stressed in financial and other ways than they've ever been. And so we absolutely will have more heart disease if we don't do what we can to mitigate that. From a foundation perspective, that's part of why we've been putting out these educational series. It's also part of why we have the Gratefulgram. There's tips every week about ways to help calm. And then I just would encourage folks also, that it's not a bad thing to reach out if you need additional help from a professional perspective. From a prevention perspective, this is definitely an area that we're working to grow, both in the Women's Science Center, or the Penny Anderson Women's Science Center, and also in our prevention areas to come. So.
Excellent. Thank you very much. So the next question is, what role does hereditary factors play in the development of various conditions, for example, blood pressure or cholesterol?
I'm so glad somebody asked that, and I'm bummed that I forgot to put it in my slide. So statistically, genetics is only 15% of our heart disease outcomes. And this is particularly as it relates to the things that you're talking about, high blood pressure and our risk of having a heart attack. What we see that is inherited, if you will, are behaviors. And so it's such a critical piece because we tend to do what our parents taught us, right? And so and I'm not trying to, as a parent myself, I'm not trying to blame everything on our parents, but the way we eat, whether or not we exercise, how we respond to stress, whether or not we take vacations, whether or not we work all day long, a lot of that isn't inherited through genes. It's inherited through what we observe. And so, for instance, for kids, one of the best things they can see is to see their parents exercise, because statistically they're much more likely to exercise later in life if they see that. But genetics is really just a tiny part of the equation. And I think that that should be so empowering to folks, that no matter what age you are, changing our behaviors and learning a healthy lifestyle has been shown, even in our 60s and 70s, to be associated with an increased decade of life. So it's never too late to start these things.
Wow, thank you very much. Looks like we have quite a few questions left. As a reminder to attendees, the only way to submit a question or comment is through the Q&A pod located at the bottom of your screen. So the next question we have is, why is it that simply being older, for example, over 65, brings a greater risk for complications with COVID-19? If we are healthy, active, and have no underlying health issues, must we still be extra careful?
Yeah, really, really, really good question. So the issue with age is that one, as we age, our immune system just doesn't work as well, and that's, I mean, literally starts. It's why kids can power through so many of these colds with no problem, and then even in our 20s they start to take a hit on us a little bit more. So that's part of why those precautions are out, and then additionally. Heart disease itself, the build-up of blockages in the arteries starts as young as age 3 and then really is a disease of aging. It is something just that happens with time. But I think your question is a valid one. It's definitely something to that I can't give you complete advice from a webinar perspective, but I do think that there's different types of healthy individuals. I have 90-year-olds with heart conditions that ski, and they are doing fantastic and they are living their lives fully. And I have 40-year-olds that biologically, might, because of various conditions, might be deemed older than that. So I think it is a conversation to have with a physician. I certainly have some patients in appointments these days calling and saying, so can you help me interpret this for me, and what does this mean? I have older parents that I want to help out in a nursing home. Can I do that safely, this or that? And I just remember that public health is geared towards populations, and so the information has to be broad, but then you often need to individualize that with a physician to figure out what makes most sense for you.
Totally, yeah, that makes a lot of sense. It looks like we have a few more questions here, and I apologize if we don't get to your question today, but there are quite a few, and we appreciate Dr. Baechler's time. So the next question is, in the long-term challenge of COVID-19, what is the one best piece of action for good mental health?
I would say getting outside, and I would say getting outside safely. For me, that is a game changer and for many of us, I think being outside in a part of something bigger makes you sort of realize that the world is continuing to spin, and each day the sun's coming up and it's going down, and that there will be another day. So I think that that's extra calming. So obviously you gotta do it in a safe way, but there's lots of ways to be outside and enjoy that fresh air and just have the breeze move through.
Absolutely, yeah, it's getting nicer out too, so that's great. So do you have any recommendations for a place to start or a website that has information and good and easy recipes for a whole foods plant-based diet?
Good question. So if you want to, I usually recommend 3 different diets depending on people's willingness to sort of start to make changes. The first one that is the most moderate, if you will, is the Mediterranean diet. And there's lots of information out there on the Mediterranean diet, lots of studies showing that it improves heart health. And then the next one that is a little bit more intense, if you will, is the anti-inflammatory diet, which is basically a plant-based diet, only it allows people to eat fish, which is different than a true whole foods plant-based diet. So I would send you, Andrew Weil has a great website specific to the anti-inflammatory diet with lots of recipes, lots of options that way to look at what's out there. And then, plant-based diet, part of it just depends on how much time and effort you want to put into that, because there's lots out there on the web, but some of them might take a lot of time. So as my sister and I say, we often do cheater meals of, a brown rice, a black bean, and whatever veggies you can find. Slice up some onions, tomatoes, throw in some sesame oil and avocado and almond seeds, and there you go. And you can do that with cans. It doesn't have to be that you washed beans yourself or whatever the case. So.
Absolutely. Thank you very much. This next question is, are people with arrhythmia issues at an increased risk for COVID complications?
So it's a great question, and so far we don't have quite enough data to say specifically which categories within heart disease have more risk. We broadly are saying if you have cardiovascular disease, that right now you're at a higher risk of COVID implications. So that would include arrhythmias right now.
Excellent. Thank you very much. And at this point, I think we have one great question I think would be good to end on before we bring up Jesse to finish us off here. But that question is, what are you most hopeful about in the areas of mental health relative to cardiovascular health? For example, are there any studies out right now or coming out soon that you are really excited about or hopeful about?
What I would say is I'm most hopeful that people are talking about this more. So that European Society of Cardiologists guideline that I mentioned, I've never seen something like that in heart disease research, that there's actually a consensus statement from the equivalent of the American College of Cardiology in Europe saying we need to research this, this is completely interconnected and we need to do more. I feel like from my colleagues here at the Heart Institute that I'm hearing more and more people talking about this and starting to address it. We have been doing some pilot programs here at the Institute where after people have a heart attack, we're asking questions about mental health to see when and how we need to get people more connected to mental health resources. So I think the dialogue is really encouraging that we're not going to kind of divide ourselves at the neck anymore going forward.
Yeah, absolutely. There's a lot to be excited about. At this point, we're going to bring Jesse back up in just 1 second. Dr. Baechler, is there anything that you'd like to say to the audience before we sign off here?
Not that I can think of. Thanks so much for having me, and I hope you guys all do something nice for yourself today and get outside.
Thank you.
Well, we'd like to say thank you, Dr. Baechler. Appreciate you coming in today and giving such a great presentation. Also, all of you who've been able to join us. These mean a lot to have you participate, and thank you for that. Earlier on, I mentioned if you want to support the great research happening at the Minneapolis Heart Institute Foundation, there is a link, is a way you can donate. Make sure you spend some time with our website. Take a look at the resources and the connections that we have, which are only going to benefit you and your heart health. Always feel free to email or call us here at the office. And social media-wise, we have Facebook, Twitter, LinkedIn, and Instagram. Be sure to follow us here at the Minneapolis Heart Institute Foundation. And thank you again. Have a great day.